Hello, my name is Alaana and I am the Commercial Director at Bupa Health Services, and I'm really excited to be here today to discuss striving for equity in the new normal. I get asked a lot, why are we talking about equity and not equality? And I think that is a really important question. Both words, I guess, are similar. They mean fairness, but equity recognises differences between us, and those differences need to be addressed in order to achieve fairness. And that's really important when it comes to women in the workplace. Because to achieve equality, we have to recognise that men and women are fundamentally different. And as such, we have different healthcare needs. So equity, it's not asking for special treatment, it's asking for basic healthcare needs that are specific to women to be met in order for women to reach their potential. Ultimately, it's about us levelling playing fields so everyone can thrive. Now, it's really important because gender diverse businesses are more successful than their male counterparts. And we are entering, I think everyone will agree, a really challenging economic climate. I think it's probably going to be the worst that any of us will have experienced. And because of that, talent attraction and retention become really important. And diversity in business is going to be key to our organisation's success. Deloitte found that businesses with an inclusive culture are twice as likely to meet or exceed targets. So rather than take a moral argument, I choose to take a financial one. And that's really important because almost every business I speak to says that diversity and inclusion are really high on the agenda. And I believe that inclusion is actually possible. And if we take mental health as an example, we've taken huge steps forward. And whilst we're definitely not there yet, but the vast majority of businesses that I speak to, well, they will have a mental health strategy. They'll have policies in place to support people with mental health issues, and they will have services to support those people. And this is being driven by necessity. So women's health is basically in the same place as mental health was 5 years ago. It's a really difficult subject to talk about. And there are some taboos, but it is important and it has to be normalised. The fundamental thing is, if we want to achieve equality, we have to recognise that men and women are fundamentally different. And before the pandemic, we were kind of baby stepping towards progress. I think it's really clear that this pandemic has affected everyone, but for women, it has been significantly worse. During the last 6 months, women have been unable to access really fundamental services. Now, this is not going to only affect our businesses in the short term, but there are huge long-term implications. One of the major issues has been around family planning and pregnancy. And to access these services, people have, access to those services have been severely affected. And we've seen big reductions in prescriptions of the pill and the morning after pill, but also key services like abortion services have also been unavailable. You may not actually be aware, but unplanned pregnancy rates in the UK are already the highest in Europe. So without these access to essential services, I think we can anticipate this increasing. And it's actually the women who are already affected are those of working age, and the cost of this is significant, not only to the individuals, but to businesses. Pregnant women have been unable to access antenatal care, and I think women have been very concerned about whether clinics are open or whether they're going to be able to access those services. And many women have actually had to give birth completely alone. So if you imagine that, with no visits from midwives or family helping them to get to grips with the new being a new mum, which for those of you who have children will understand is already a really emotional and overwhelming time, I think you can understand the mental health implications of this. Fertility services stopped for some time, and that meant that women that were going through treatment had to postpone until further notice. So not only were they unable to access treatment, but it meant that they had to go through a few months of just not knowing whether they'd be able to carry on, whether they'd be able to access services again, whether or not they're going to be able to have children. And the mental health implications of this are huge. 90% of women that go through fertility treatment already experience depression, and this is going to be hugely exacerbated. And then it comes to essential life-saving checks like smear tests, or mammography, this has been postponed too. So women haven't had access to potentially life-saving screening. So prior to the pandemic, we had, I think it was around 5 million women out of smear cycle. And during during April and May, we would have missed, I reckon, around 600,000 smear tests, which would have been carried out if we were operating normally. So we can only guess at what long-term implications are here, but obviously early diagnosis leads to better prognosis, and this is going to be an issue for women and businesses alike. Now, finally, the one which I think is most difficult to hear is around women's safety. Now, during the COVID pandemic, I think it's been very well documented that domestic violence has had huge increases. Refuge, who are a domestic violence charity, reported a 49% increase in domestic violence calls to their helpline within the first 3 weeks of lockdown. And this, I think, is terrifying. There have been women who have been unable to access service, who've been unable to get help, and they've been locked in for weeks with their abuser. So I think all of the impact of these different factors have huge physical and mental health implications for women, but also for you as businesses. It's understandable that we will have reduced productivity, the engagement and performance is going to be affected by this. And I think it's really important that we as a society and as business, that we collect data so that we can better support women. And I think that we are, well, I mean, Boris's announcement, we are entering uncertain times where access to services are likely to be sporadic for the foreseeable. And we need businesses to step in to support female talent. And it's not going to be that difficult to do so because there's so much that we can do to support people. If we look at how we educate our leaders, if we look at our policies and we look at how we can better support women with services that might be unavailable, those are 3 things that very quickly we can do to better support women. So firstly, companies need to educate themselves on these topics and understand that women's health has to be a priority, whether they're in the office or not. I've noticed from the customers that we speak to that there is a huge temptation to think that people have less responsibility if people are out of the office. But I would argue we have more. We have a duty of care to ensure that employees are safe. And without those face-to-face touch points, we have to be much more structured in how we do so. We have to educate our line managers. We have to enable them to have inclusive conversations and understand that these things are really important. So sharing information and running campaigns is one way that businesses can do this. We've got World Menopause Day coming up in October, which is fantastic. And I don't know if your business already has a menopause policy, but if it doesn't, it should, and we will be circulating information to make this really easy for your businesses. I think a lot of women's health is still really taboo, and if we normalise that conversation, we enable people to better access support. I think we have to go beyond tick box exercises. And so whilst symptoms are personal and they are embarrassing, we can empower leaders to normalise conversations, to reduce these taboos. And I think by doing so, businesses are going to reap the benefits of being at the front end of recruiting and retaining female talent. We also have a responsibility to staff on furlough, and particularly when it comes to their health and well-being. So we should consider how we could step up support, either by concentrating communication or by launching some kind of peer-to-peer initiative that encourages people to reach out and continue to have a network. We found that furlough can be extremely isolating, as can it be for women on maternity leave, who we need to support. I've already highlighted that childbirth and becoming a new parent during this time has been really stressful, and many are concerned about having a job to return to. So particularly if your industry has been badly affected, reaching out to them and reminding them of the support that's available to them can make a huge difference to those people. Secondly, we need to look at policies. If you had policies in place in the first place, well done you, because I know a lot of people didn't. But if you do, we need to check that those are still fit for purpose. All of our policies now need to reflect the implication that the pandemic has had on our physical and mental health. They need to reflect things that we've never had to think about before, like domestic violence, as well as menopause, fertility, as well as things for everyone like bereavement and musculoskeletal issues. If you don't have a flexible working policy, I think now is really the time to be thinking about it. Employees, particularly women, are juggling things like childcare. And we need, me personally, I understand how stressful that can be. And we need the ability to work flexibly. The kind of 9 to 5 is no longer appropriate or normal. So we need to make sure our teams are really empowered to understand what they're able to do, and that we don't expect our people to be online, moving from conference call to conference call. There used to be like this kind of culture of a coat on the back of the chair, and now the pressure has been moved to seeing people online during working hours. I think moving from conference call with no break, not getting up to exercise, and not being able to meet the needs of potentially your children if they're in the house is not going to get the best from our people. As leaders, we have a very unique opportunity, which is to create a new culture. And that culture has to be based around flexibility and trust. I think, by making sure your people know that they don't need to respond to emails straight away, or that they can just pick up the phone to you if they're feeling stressed. As we see more disruption to schooling throughout the winter, which I think is inevitable, we have to be prepared to support our teams, ensuring that people are able to juggle the demands of family and work, which are likely to change on a weekly, monthly basis. Now, finally, services. I think now more than ever, it is absolutely essential that people are aware that they have access to services. It's very evident that NHS primary care is going to continue to be very badly affected, and we need provisions in place to support our people. So whether this is access to things like an employee assistance program, virtual GP service, company-funded smear testing, employees need to know that they have the services in place to support them and their family. Employees, and I would say in particular women, need to have a very personalised approach to their health and well-being. So women going through menopause or fertility want their employees to understand what they're experiencing and to have access to support, whether that's for the mental or physical aspects of these transitions, and the policies to reflect their needs. I mean, ultimately, I think everyone agrees that diversity is good for business. We know that. And in the last 20 years, we've moved huge amounts in terms of gender equality. However, I have to be honest, the last year feels like we've taken a huge step backwards whilst we're at home in lockdown. And as we enter a time of economic hardship, it's really important to remember that it pays to encourage a mixed gender workforce. Change is always the byproduct of three things: education, policy, and services. And as we move into this next phase of the pandemic and potentially beyond, because I think we need to be realistic about how long this is going to last, it is really important that we implement things that, such as remote services, and we are flexible to women. We need to understand from a line management perspective what it is that our teams need. And we need to have adaptable and iterative strategies that are going to improve women's working environments. I believe that this in turn is going to help companies perform at the best of their ability. As I said at the start of this presentation, women do not need special treatment, but we do need businesses to act in ways that levels playing fields and that we change perspectives so that everyone can thrive.
Thanks, Alaana. Lots of really great insights, lots to think about, and there's a lot of thinking that obviously your employers need to be doing, particularly as a result of the pandemic as well. So let's get straight to questions. Just looking at the poll, you asked, does your organisation have policies in place to support women's health and wellbeing in the workplace? And we can see that no one said yes, unfortunately, but we do need more was 53%, no was 35%, and don't know was 12%. I just really wondered, is that what you were expecting, and what your thoughts were on those results?
Yeah, I mean, it's slightly higher than I was expecting. Last time we did a survey, I think only 10% of businesses had a menopause policy in place. But it was something that was quite high on the agenda. So I'm really pleased and encouraged that we've got, almost over 50% of businesses actually looking at this. But it's very clear that there's still more to do, which I think creates a great opportunity for us to be thinking about it now during this time.
No, definitely. And culture change and introducing new policies obviously does take time. What are some of the quick wins that you think employers can be doing now to support women's health?
I think absolutely culture change takes a long time, but there's things like education, which is very low cost, that we can do immediately to support people. So educating line managers and staff around the symptoms of women's health, so periods, fertility, menopause, and then obviously around the domestic violence, which is obviously a very sensitive issue. And in addition to that, making sure that those policies are aligned. So I think by tackling it at all levels of the organisation, from line managers right the way through to everybody else, I think that it opens up the conversation and enables people to be better prepared to have these conversations.
Brilliant. I think there's lots of people saying totally agree. I have so many things to think about. I've got a question here from Abby Blanco. She's said, what do you think is the best way to get traction on implementing more or better policies when there's a very old school male leadership team who are less than willing to see the benefits of focusing on employee wellbeing, which I imagine is the case for quite a few of our attendees today?
Yeah, I mean, it is a challenge. I think one of the first things is really bringing it back to the business case that I spoke about initially. If we're coming at it from a kind of moralistic, whilst there is a moral argument to this, I think it's much more compelling, particularly if we're dealing with a, predominantly male, potentially old-fashioned board. We need to bring this back to the financial return, and I think that that's been proven. I think some of this stuff is that people feel very uncomfortable about it. So it comes back to normalizing those conversations, breaking down these taboo. And I think because we don't talk about women's health a lot, we don't talk about periods, we don't talk about menopause, it kind of reinforces the idea that these topics are shameful. So actually having these conversations, and potentially they have wives or daughters, and kind of bringing it back to that humanistic element, I think is also important too. It is a challenge, and I think that the more we can do to normalize, the more success we're going to have in the future.
Absolutely. And I've got another question here, which I think we've got time to answer, around how can a provider like Bupa support an employer with this type of dialogue? So how are you working with employers on this at the moment?
Yeah, so I mean, a number of our customers have introduced things like on-site, well, when that was relevant, but access to primary care, screening specifically for women's health, being able to implement things like virtual GP services, also allowing people to have access to EAP, so that people can have these conversations. Typically, you need buy-in from the top. So I can't remember the name of the person that asked that question, but we really do need that senior leadership team to buy in. And then we also need people to be modeling these behaviors. So we can help with those conversations, we can help build those business cases, and we can provide actually quite a lot of free resource, particularly around, we've got October Menopause Day, as I mentioned. We'll be providing a lot of free resource that you can take into your businesses and use.
Brilliant. So I think we've got kind of time for just one very quick question. What do you think is the most relevant benefit to give women access to in regards to healthcare services, to finish up? We've got about 20 seconds.
20 seconds. Okay. Almost all female health is dealt with in a primary care environment. And that is the one thing that has been massively affected by this pandemic. So if it was my team and I was able to give them one benefit, it would be quick access to GPs, whether that's virtual or face-to-face.
Brilliant. Thanks, Alaana. I mean, just so much to think about, I think, and lots to discuss with our various senior management teams. So thank you very much. That concludes our session this morning. You've got a couple, thank you. We've got a couple of minutes now, so to grab a quick tea or coffee, have a stretch, and we'll be back here at 11:45 for the next session. Thank you.